First, let's talk about the COVID vaccination compensation system. And let's go straight over to the co-founder of the Better Together Declaration. That's Alan Miller. Hello, Alan.
Hi, Kevin. Good to see you.
Thanks for joining us. Really pleased you could come on board on this miserable bank holiday down south. Anyway, gather the weather was nice up north, but I didn't see any of that. Now the vaccine damage payment scheme, which is what it's called, is there for people. You know, whisper it quietly, but the COVID jab for a small number of people killed them. Basically, they were allergic to it or whatever. No vaccine is perfect. So there are people out there who deserve serious compensation from the government for this vaccine, for what the damage that this vaccine did to them. Now, these compensations, they took a long time to get going. I remember after a year, no one had managed to claim successfully, but they're up and running now. And apparently, recently, over recent months, the claims for COVID jab damage to the VDPS have rocketed to the extent that the VDPS is apparently overwhelmed and, according to some critics, completely not fit for purpose. So people who deserve compensation are not getting it because of this disorganisation. And the Health Secretary Victoria Atkins has ordered a complete review of the system. So this is one more chapter in the saga, almost the comedy of errors of the way this government has handled the COVID crisis, in my view, from start to finish.
Yeah, I think the thing is, Kevin, there's a few things here. The first thing is, as you say, it took a long time. Firstly, people were smeared, they were derided, and it took some time and a significant amount of work by families and a few brave people to actually make the case when a lot of people were censored and shut down for saying anything about the vaccination. And as it happens, people can say, well, there's always some small side effects with all vaccinations. The number with the ones we're discussing for this are far higher proportionally. Many have been addressed far sooner with other vaccinations. And we know recently that Pfizer accused of bringing disrepute to the industry, and that AstraZeneca has been associated its COVID jab with some serious side effects. The numbers have gone up. They've rocketed up now. Can
I quote them to you? I've got them all here, just so as people can get a grip on just how shocking these statistics are. Now, in 2019, there were 27 claims for compensation for the COVID jab. In 2020, the following year, it went down to 26. 2022, there were 480. Last year, 4,008. And check this out, so far this year, up until April, so it's only 4 months, isn't it? 5 months, I guess, if you want to be generous. 11,022 claims are being made to this scheme. What is going on here? Is this people are sort of getting the guts to have a go for compensation, or are they suddenly starting to feel the illness caused by the jabs?
Well, I think there's all sorts of things going on. I think partly it's the processing, it's the time thing. I think there's a number of things that have been going on. There's a number of impacts in a range of areas. It's the case that before there was a recognition, there was something like 4 people working in a previous department. That went up to 80 people. Now, Victoria Atkins quite rightly saying it's got to be reviewed further because the amount of increases. We've seen things, you have to have a certain criteria, a certain benchmark of disability, which some people are arguing is not justified the way it's assessed as well. But in the amount of how disabled you are, or impacted as a consequence of the vaccination, and that's got to be demonstrable. I think the thing is, Kevin, with all of this, if we remember what was told to everyone was that we know that this was something originally that was going to be very dangerous for highly vulnerable people and very old people, the COVID situation. And what happened was there was a mass campaign of nudge and fear and threats and mandates and impositions to terrify everybody. There was 60-year-olds, 50-year-olds, 40 or 30-year-olds and children to have a procedure that majority of them did not need. And in that context, it's even more scandalous that this has happened because, it's the case that was recognized and understood at the time. And as we've seen in some of the lockdown files and other discussions, and some people were making the case from the very get-go, as it happens, that there was a recognition both about it not ability to stop transmission, and nevertheless, all these measures were imposed and people were spied on by the government, the DCMS, the Counter Disinformation Unit, journalists, doctors, citizens. And some of the people now very silent, those that were screaming out abuse, saying it's conspiracists. They do shout conspiracists on other issues now, if you're not happy about what's happening on our streets.
That's right, yeah. Yeah.
But we need to make sure, Kevin, this is the key thing. We need to make sure that there's a proper, open, transparent, robust assessment of this, because some of the impacts mean that it's having an impact in a range of medicine and lack of trust for science more broadly, right? Really debilitating for other measures and interventions for things for children and elsewhere. Parents are now not trusting what's being said to them. These things are serious, right? We as a society need to be able to trust. You can't have informed consent and choice if you don't know what's going on, if you're being spun things, if things are just, experimentally done, told us it's all safe and effective and that's all great. And then you find out and discover it's not the case. And then people knew about that as well. This is a problem for trust and it needs to be addressed openly. And it's a serious concern that we haven't really addressed properly.
Yeah, I'm wondering whether, so if we've had 11,000 claims, and we don't know the veracity of all of these claims, but 11,000 claims so far this year, that's going to add up to, 44,000 by the end of the year. It seems like, to my mind, an unacceptably, if these claims are genuine and these people genuinely suffered damage at the hands of the COVID jab, it seems to me those numbers are too high. We shouldn't have 44,000 people saying, oh, I was made to take this jab by this campaign of fear launched by the government, and guess what? It hasn't done me any good at all. But what I want to discuss with you now, Alan, is lockdowns. The World Health Organization, Britain among other countries, has just signed up to what's being called a treaty. It's actually an international agreement, a World Health Organization pandemic treaty, due to be ratified later this month. And if that goes ahead, what we're effectively signing up to is an agreement that as soon as we get another pandemic, we plunge ourselves straight into lockdown right away. I'm very sick of people telling me lockdowns were brilliant, they were effective, they're the only way to stop COVID and other viruses. I'm not convinced, and I want to know why it is we're signing up to this lockdown first policy by an international globalist organisation, and why it is that our ludicrous COVID inquiry will not question whether or not lockdowns were even necessary.
Well, the lockdowns were an unmitigated disaster. They're an assault on society. They took away freedoms and liberty. They actually, in many ways, have caused far more damage than any is a betterment that they actually asserted. We've seen across the board now in terms of the economy, in terms of our health, delayed cancer, stroke, heart disease, the impacts of excess deaths now that we're seeing, particularly in younger people, the impact on care workers, because we're talking about the vaccine mandate, 45,000 people left. That's had a knock-on effect on the NHS. Across the economy, 15,000 hospitality businesses went out of business. Many more subsequently now have been. We've seen families disrupted, education impacted, young people, mental health and a range of other issues, as well as older people and the impacts on things like Alzheimer's and others, and dentistry and a range of other areas that have been enormously impactful as a consequence of lockdowns. We should remind ourselves that sovereignty is paramount. Sajid Javid was flippant about this when we pulled him up on it at the time. And he said, well, we will, of course, retain our sovereignty. The problem is, Kevin, that it was the British government that impacted this using the Public Health Act the first time round. So whilst it's really essential that we do push back, and there's been some good wins in terms of this with the WHO and the international, the IHR agreements, it's good that there's been some changes made, some good work people like Us for Them and others have done and asserted it. We should remind ourselves that it's our own Public Health Act that was used to assert lockdowns, and that needs to be addressed. We should assert never again lockdowns, right? The cost benefit analysis was never done, and we're now going to be suffering for generations as a consequence of what happened. And the world is a different place from what it was before, and the whole idea that we are perhaps just something to be feared from one another, and that the way to solve these problems is to prorogue Parliament, to stop any democratic debate and to lock people up in their houses and have surveillance. And we can see some of these dynamics, unfortunately, Kevin, in how things are happening in our streets, the discussions around 15-minute cities, low traffic neighborhoods, surveillance, limits, restrictions, impositions, a continuation, keeping you safe, keeping the world safe, the environment safe for your benefit by these globalist organizations and by our government. So the antidote to that is to make sure we all hold people accountable. And that's why we say to people to get involved with Together. We're going to continue in doing that and saying that the public has to be put first, our needs and our interests, not what's happened in the last 4 years.
A few words from you, Alan, if you will, about this COVID inquiry, which refuses to include in its remit the essential question that all of us are asking is, were lockdowns even necessary? Now, my argument about the lockdowns, I've probably said it to you before, it seems to me eminently logical. They didn't work because we had a lockdown. And then after whatever it was, a few weeks, a couple of months, we came out of lockdown. Oh, it's marvellous. Look at the death rate's way down. We've done it. 3 weeks later, oh, blimey, we better go back into lockdown. The deaths are soaring again. So we go into lockdown again. The death rate slows down because obviously if no one's contacting each other, no one's leaving their home, you'll have the virus won't spread. Then we come out of lockdown, immediately it comes right back, and then we do it again. In other words, once you have to have a subsequent lockdown after you've had the first lockdown, it clearly proves the first lockdown didn't work. So why isn't the COVID inquiry considering the efficacy of lockdowns? Why is it its only question is, did we lock down early enough or strong enough? I mean, it's ridiculous.
Well, I mean, as it happens, Kevin, like each time they did a lockdown, the actual numbers were on the decline as it happens if we look at them. But the key thing to, you've asked the key question, and it's an absolute scandal that this inquiry has not asked that key question. Of all the things it should be asking about what happened during that period, the question is, why were lockdowns used? It was unprecedented. It was the true thing that was unprecedented. We had a pandemic preparedness strategy. It was only ever used once before in a very small area in Mexico, and then China did it. Jeremy Hunt loved that moment with China. Some people were, like fawning over it, and in Labour as well. And then all of a sudden we have it imposed on us. Talk about something that's never been done before with no assessment and evaluation of the impacts and consequences. And for a society that was obsessed with risk aversity and with making sure you do cost benefit analysis on almost everything and risk assessments, it was absolutely really remarkable moment and terrible. The fact that the inquiry, the COVID inquiry, is not assessing and asking the question, were lockdowns necessary? Why did they happen? And should they happen again? Just means that really it's not fit for purpose. There's some interesting things that have come out from it, but that's got to be a core question. And that's also why at the Together Declaration, we've carried on campaigning. We invite people to become members up and down the country, to organise groups and to make sure that we're not going to allow this to happen again in Britain to us.
Alan, it's fantastic to talk to you, and let's talk about this as much as we can. I think it's a very important issue.